Good morning, this is Dr. Edgar Stewart from OSSE. We will be getting started in just a couple minutes, just to give some folks some time to get in. So just indulge us for a couple of minutes and then we'll start. In the meantime, if you can't hear me, or if you are able to hear me, please use the chat function and just let me know that you can hear me. Great, I see that you can hear me. While we're waiting, I just want to point out a couple of things for you all. There is a handout. If you look in the interface under handouts, you'll see that we have a PDF version of the slide presentation today. We'll also be sending that out after the webinar as well. But if you want to follow along, please feel free to pull down that handout under the handouts in the interface. We'll give it one more minute and then we will begin. Okay, let's get started. As I said, my name is Dr. Edgar Stewart, and I work here at OSSE, working with non-public schools in compliance and investigations. Today's presentation, we will be working and really discussing supporting non-public students' mental health needs. A couple of housekeeping items, just to make sure you can follow along with me. We've uploaded a handout, which is a set of the slide presentation in the handout section. So feel free to follow along with that. If you want to take notes, just go to the handout section in the interface. Please use the chat or the questions throughout. If you have questions or comments, towards the end, we'll be having a small group discussion, and I will be unmuting folks at that point once they raise their hand, and then we can have folks be able to provide some input onto some of the prompt questions that we have. Let's begin. So our agenda today, I'll introduce myself again, and we will cover our objectives. There'll be some poll questions throughout, a few to start, but some additional ones to help us with some feedback to really get a pulse on kind of where you all are experiencing some of your challenges with students' mental health needs. We will also be reviewing and identifying mental health resources that are specific to the DC community where your students live. Also looking at the LEA Recovery Resources as well that you can find on the OSSE website. Hopefully this shouldn't be new information to you. LEA should have been soliciting your input in the development of our continuous learning and education plans, and providing non-public schools with ongoing supports for their students as well. We will have some group share out towards the end after we discuss the mental health and LEA recovery resources, and then we'll wrap up with questions. So as I said, my name is Dr. Edgar Stewart. I work with a team who supports non-public schools for district students who they're serving. The team consists of the manager, Sharon Powell, who's actually on leave right now, and a team of monitors, Tony Lemons and LaShonda Wilson. Tony Lemon's actually just left the agency as of yesterday, so I'll be filling in for her in the interim as we recruit for that particular position. And we recently hired a new director of the Office of Special Programs and Populations, Dr. Kelly Rudd-Saffron, and you'll be hearing from her in the near future to really introduce herself to our non-public community so that you know who's really kind of running our shop at the higher end. Objectives. What do we plan to cover today? Our objectives are threefold. First, we will talk about and learn, and I will share with you community-based resources available here in DC that are designed to really identify those supports for our students' mental health, psychiatric concerns outside of the school environment. Secondly, I want to share with you the LEA-based coronavirus resources in terms of recovery, both behavioral supports and academic supports that are available to students outside of the home, and really to help you get a sense of what LEAs are doing and thinking about with regard to students' academic and social emotional needs. And then finally, I hope to have a hearty discussion with you all and hear from our colleagues within the field, you all, what your experiences thus far have been with supporting students' mental health needs, both within the school environment, but also kind of peripherally outside of the school environment. So let's start with a poll question. Okay, we're just going to do this briefly. The first question, what percentage of your students have experienced issues or challenges outside of those included in their IEP? So again, we're really thinking about not those things that you're dealing with in school, but what kinds of issues and challenges do you see that your students are struggling with outside of their IEPs? We'll just give it another 30 seconds or so. I don't want to belabor these poll questions, but it will help us to get a sense of some of the things that that you all are experiencing that we'd like kind of more feedback on and how we might be more supportive of those issues. Okay. We will close that poll question. It looks like the majority of you are indicating roughly between 40% and greater than 75%. That accounts for about 82% of those of you who have voted thus far. So a significant majority of your students are experiencing challenges outside of those listed in their IEP. Let's look at the next poll question. In relation to, in what areas are your students experiencing their most significant challenges? The way this question unfortunately is worded, we're looking for a single answer. We certainly recognize that many students and many families are experiencing multiple issues, but just to give us a sense of what you see as kind of the most significant single challenge. We'll give it another 10 seconds or so. Okay. So it looks like here, roughly 3/4 of you indicated medical, psychological, or psychiatric as the single most challenging issue that your students are facing. Substance abuse and family violence came next. Okay. Third question. This one's designed to really help us get a sense of what you know about services here in DC. Just another 10 or 15 seconds. Okay, what we're seeing here is that roughly 3/4 of you are aware of services and either made the appropriate referrals or provided the information to the LEA. The other 25% or so, these numbers are fluctuating here, said that we're not aware of specific services that students had in their community. So hopefully we will be able to provide some of that information with you today. Okay, let's move on. Okay, so as I said, our first objective is to be able to review community-based resources available to DC students with regard to their mental health and psychiatric concerns, really outside of the school environment. And while we recognize that for non-public schools, whether they're day schools in the area or residential and psychiatric treatment facilities, that are located out of state, OSSE recognizes that the focus of the work that you all do is really addressing students' social, emotional, behavioral, and academic needs within the school environment. The degree to which you recognize that the connections, when we think about the whole student, the whole individual and their families, really gives us an understanding that, there are likely issues that come into school and that transcend the school environment that students will be affected by, and that students' families will also experience difficulties and challenges with. So the degree to which you're aware of the resources that may be able to help your students outside of the focus of your work with students in the building, we really would like for you to take advantage of that information, work very closely with your LEAs to make sure that they're aware of it, because many, all of those LEAs are located locally, and really can serve as a hub and a liaison to making sure that students are getting whatever supports they need, whether it's within your school buildings or within their home communities. We recognize that there are certainly, labor-intensive kind of issues here as it relates to just funding and resources, but really our design and our focus of this webinar today is to at least provide you informationally with those resources, and in conjunction with working with the LEAs, just to make sure that you can make appropriate referrals as possible. The degree to which you collaborate or participate in community-based meetings is really individual decisions that make sense for your students' needs and for the resources that you have available within your schools. So we're going to jump right in. So in looking at the DC area resources, this is kind of the overall kind of breakdown of some of the information resources that we'll cover today. As you see, there's a kind of wide variety of supports in terms of mental health support services, addiction and prevention and recovery, also self-help, when it comes to issues like domestic violence, students who come from military families, grief and loss issues. There are also more psychiatrically intensive services that are available here in DC, when it comes to crisis services, intensive outpatient mental health services, also inpatient services as well. So we'll cover these in some more depth as we proceed. So let's start with crisis-based intervention services. Really, what we're talking about here first is more intensive inpatient psychiatric care centers. As many of you likely know and probably have worked with some, the district has several inpatient psychiatric centers that children can access. They include Children's National Medical Center, the Psychiatric Institute of Washington. But then also, as we think about some of our students' kind of needs and where they're going to school, you may also need to know the resources that are more in your own neck of the woods, including Northern Virginia. So places like Inova Fairfax Hospital, also in the Baltimore area. We're talking about inpatient facilities, including Shepherd Pratt and Adventist hospitals. So I'm curious. The degree to which you've already experienced students experiencing mental health crises where you've needed to tap into some of these inpatient resources. Here's a place where you can either in the chat or in the questions just provide some feedback, and I'll review a few of these and summarize them as we continue to talk. So in addition to the inpatient services to deal with crisis situations, DC also offers a variety of community-based crisis intervention services. And these are more mobile crisis services that can be tapped into to mobilize to any part of the city where children might be experiencing a crisis. I'm sure some of you have experienced students who are kind of on the cusp of experiencing some challenges at the end of the school day, and or as you've been working with students in a virtual posture, you've seen things going on over kind of virtual instruction or virtual related service supports, where you felt like there needed to be some other entity supporting students who may be in crisis. So we have through the Department of Behavioral Health, the Comprehensive Psychiatric Emergency Mobile Crisis Program, CHAMPS, which is out of Catholic Charities, is also another mobile crisis service that is here in the district. And then finally, CFSA for those students who are in the care or who are having care kinds of issues in terms of being able to be managed at home. CFSA has their own mobile crisis stabilization services. So again, I'd be interested to hear, and I'm sure the group would be interested to hear any experiences you've had tapping into these services with your students as it relates to, their needs, either leaving school or, when you've seen them over virtual instruction and felt like they needed additional support. Okay, we got some feedback coming in. So just give me a second to take a look at this and I'll share that with you. Oh, this is great feedback. Champs did a home visit, positive experience with the mobile crisis team. Champs helped complete suicide assessment for one of our families. Great to hear. One challenge that was faced by a staff member in a school, and it certainly reflects something I'm sure we're seeing nationwide, is understaffing. The challenge that is faced nationally is understaffing. Also, students who are savvy to what needs to be said to not be evaluated and therefore not get the service that is actually needed is also a concern. Due to changes in healthcare, it seems that students that need more assistance are not getting it because hospitals are quick to release students. And those certainly can be, ongoing challenges. And, I wonder to the degree LEAs are aware of these kinds of issues and can also kind of help keep a pulse on, what additional family supports and, whether it's family preservation, whether it's also, partial hospitalization programs that also might be available for students as well to support them when they're not able to get seen or they end up not getting admitted to inpatient settings. Okay, great feedback, thank you. All right, so let's move on. So DC has a plethora of day treatment and psychiatric disorders counseling, and you'll see a list of them here. All of these links that are in here have been checked, and you can. It's certainly just a selection. What I'll be sharing with you later on is a much more comprehensive resources guide that has many of these live links, descriptions of their services that you'll be able to see. So please don't consider this list to be comprehensive on any of these slides. So you'll see the more comprehensive resource guide later on. But here you'll see not only kind of larger healthcare systems like Georgetown, Children's National, but some of the other psychiatric resource centers that are here in DC dealing with psychiatric issues and counseling. So PIW, as well as DC Department of Behavioral Health has a child psychiatric practice group. So some of the things to kind of keep in mind here, children who are duly diagnosed, more comprehensive mental health and psychiatric treatments can be accessed in some of these centers that are listed here today, including family therapy. And again, so as we move from more intensive crisis-based services to more ongoing counseling, we see some of the resources here. Many of our DC schools have school-based behavioral mental health programs that really support students' mental health needs more, and this is more on the general education side. So again, it likely is not relevant for your non-public students, but what you can think of is if there are other students, if there are other youth in the home who may be experiencing mental health challenges, it's certainly one resource to be able to point families and LEAs to be able to access. Other outpatient counseling settings include the Mary Center, Episcopal Center for Children, Calvert Hospital as well. And these are services for both children and youth. They include diagnostic assessments, they include evaluations for medication, as well as intensive family therapy. So while the focus of the resources thus far have been much more individually based in terms of the students who you're working with, We also want to make sure that we cover some of the supports that are available to parents and families. So here, there are a number of family support and parent education centers here in the district that include both DC agency-based, and that's, programs under the Department of Human Services, and under Child and Family Services, there are family preservation services that are available as well. Private organizations like St. John's Community Services, the Kennedy Institute, and Perry School Community Services. So these are supports that are offered to children's families and their parents in terms of parent education, counseling, parent training. So again, we'd be interested to hear from you all about any experiences you've had, either working with these, making referrals to these organizations, or providing that information to LEAs. Children who are transition aids, that is, excuse me, who are experiencing transition kinds of issues like homelessness or running away, who need supervised apartment living situations, case management supports. The Latin American Youth Center Transition Living Program is one excellent program, as well as Sasha Bruth Youth Work. So again, these are programs for transition age youth who may be experiencing issues, where they need some supports as they're transitioning to other settings. Like I said, homelessness or running away. I see a question here, and I unfortunately don't have the answer to it. It's one I'll have to get back to you on. Can these students still be in school? It's likely that they are not. These are students who are having difficulty remaining in school settings, and which is the reason why they're in these transition programs. I'd really need to find out from these specific programs, what the kind of criteria are. I'm happy to do that and follow that up when we send out this information. So the Department of Human Services has several more intensive case management programs for students and their families when it comes to such issues that, we would kind of typically think of PINs or persons in need of services. The PASS ICM program, the intensive case management, really works with students, as you see here, who are 10 to 17, who are engaging in those kind of behaviors that are keeping them out of school, such as truancy, leaving home without permission, not returning home by curfew, and also experiencing, severe disobedience or disruptions at home. The PASS program really tries to intervene with these students early enough to make sure that they are staying out of or diverted from the juvenile justice or child welfare system. So it's a very intensive program, and if you feel like your students are kind of at risk for that as you're seeing truancy issues, I would certainly encourage you to talk with your LEAs about what you're seeing and whether this program, the PASS ICM program, is something that makes sense for them. So again, it's just something to kind of have in your portfolio of supports available to provide to parents and to be discussing with LEAs. PHS, I'm going to talk about them for a couple of slides, also has a functional family therapy program that again really provides in-home supports to families, not just a student of interest, but really from a short-term therapeutic model, trying to ensure that those same kinds of behaviors are addressed, and students can be diverted from juvenile delinquency pathways, and really provide much more supports within the home from a functional therapy model. So this is another thing that through the DHS program that students, their families, and LEAs can kind of look into, depending on what kinds of issues you all are seeing that students may be wrestling with. So what I would say in terms of PATH ICM, the functional family therapy, and the next slide, which I'll get to, which is also another extension of PATH as well. All these programs are under DHS. And if you're thinking that your students may need to be able to access these services, follow the links here. They provide you with not only the website information, but contact information as well, for each of these programs. I also have some contacts at DHS, so if you're having trouble getting access to the right people in those programs, certainly feel free to send me an email and I can shoot you additional contact information, if you're not able to follow the links that are in here. All right, and like I said, this the past crisis stabilization, the crisis and stabilization team really looks at much more intensively, youth who are in these transitions and are having more immediate family crises. So assessments can be done to look at what that student and that family in crisis needs in a more immediate kind of setting. PCAS, they work with the PATH ICM program as well. There's a lot of overlap, but really here what we're talking about is a much more short-term intensive crisis stabilization, for the things that are going on in the family. So again, I'd encourage you to take a look at the more intensive and detailed descriptions and program information once you follow these links to be able to get a better sense of some of the nuances of them and how you might access them. Again, same thing with, again, DHS's Family Violence Prevention Program. So here what we're talking about as an extension of PCAS is really being able to, once individual needs are determined, and if the family is determined to need some emergency shelters for the children or other caregivers who are in the family, those can be accessed through this Family Violence Prevention Program. There's ongoing case management and individual and group therapy. So again, we encourage you to take a look at these resources. So as I said before, the more comprehensive resource that you'll be able to find, many of the resources that we discussed here today come from the Department of Behavioral Health Resource Directories. Having worked at DBH, having developed online resources for several organizations, I can tell you that the biggest challenge becomes making sure that the information is detailed, is accurate, that there are working phone numbers, that there are contact people who are at the end of those phone numbers who can actually provide you with the information and start processes, but also to make sure that the information stays current. The Department of Behavioral Health does a phenomenal job of maintaining the Behavioral Resource Directory. Many of the links that are in here, I can tell you, are active links that, I know some of the folks who work in some of those programs and can tell you that, they're current links. So I encourage you to take a look at this very comprehensive Behavioral Health Resource Directory for the DC, for DC, in all of the areas that we covered, and there are several more that we didn't really get a chance to cover that are less kind of relevant for the focus of this presentation. But still are under the auspices of, larger behavioral health. So I encourage you to take a look at this resource directory and, to have it. So how might this be relevant for schools, that are more residential schools in Georgia, in Florida, in Michigan? I think when it comes to thinking about, who your students are, what you're seeing for the challenges that they're having in your settings, but also what they came in with, where they had been before. Likely students who are in residential settings have been in day schools before and will likely return at some point in the future to a step down to a day school, in terms of a less intensive need that they may be experiencing or progress that they may be making in some of their issues and challenges. But it also is relevant to be thinking about and asking questions during MDT meetings about the kind of resources outside of the school environment that a student might need in the discharge planning process, or the annual IEP meeting as it relates to, thinking about LRE. So, I encourage, the residential schools, the psychiatric residential treatment facilities, not just to, kind of discount this information as it, relates to your students, since you have them for a long period of time and they're certainly far away from DC, but really be thinking about it in the context of when students are being planned for in terms of, returning to a day school or returning to, their LEAs within the DC community, what additional supports will be needed. So just so you're aware, some of the agencies that are listed here on this, these are all DC child serving agencies, when it comes to, supporting students' needs, whether it's Department of Health, whether it's Human Services, Parks and Rec, for summer employment programs. Those agencies are listed here. So, you have a kind of one-stop shop for being able to access, if you have students who are part of these, who are involved in any of these agencies, you have the contact information as part of these links. For schools that are more locally based, whether you're here at non-public schools in DC, whether you're in Northern Virginia or surrounding counties in Maryland, the DC has a DC Behavioral Health Community of Practice that really serves as a hub for, those providers and school leaders who are supporting DC students' mental health needs. The community of practice is really designed to help provide that hub so that students can be, so that service providers have a learning community, to be able to share information, to be able to make connections with the community-based organizations that are here in the area, to build knowledge, to be able to support the implementation of best practices, and solve problems of practice. So certainly things like, what was discussed before in terms of staffing issues, being creative about things like how do we ensure that our students' evaluations can occur timely, so being able to tap into additional community-based resources when it comes to private clinicians, graduate programs that may have graduate students who are serving under the license of, related service providers in those settings. Certainly, the community of practices is one information hub that, you might think about tapping into, again, as your resources, make sense, to be able to know what's going on in DC and to be able to tap into best practices and knowledge resources. So I encourage you to check out this community of practice. Okay, so briefly, we're going to transition. I'm going to pause here for a couple minutes just to see if there are any questions, thoughts, or feedback before we move into looking very briefly at the LEA Recovery Resources. Okay, I'm not seeing anything come in, so we'll move on. And if anything comes up, we'll certainly come back to and go over that feedback. So moving into the LEA Recovery Resources, many of you all over the past 6 to 8 months likely were aware of, and if not participated in the shaping of our local school systems or local education agencies' continuous education plans. These plans really were designed to cover 4 areas, which we'll get into very briefly, or 3 areas, which we'll get into very briefly, to make sure students' learning needs were addressed. However, before we move into that, I wanted to conduct an additional poll question. Excuse me. Okay, we'll just give it another 15 seconds or so. Okay, so it looks like roughly 60% of you or so have worked with your students' LEAs to put in place additional pandemic-specific recovery resources. So roughly about 40% of you have said no. Thank you for that feedback. Okay. All right, so as I said before in the beginning, with regard to this objective, we will share with you resources that you can tap into to look at each individual specific LEA's COVID-19 recovery, behavioral support services, resources that students have been designed to address students' needs, whether they're accessing it at home, at school, and in the community. So as many of you all know from our previous webinars, and if not, please, I encourage you to go back to our resources on the OSSE website from our previous webinar, where we covered the guiding principles of continuous education. We did that in the 2021 school year. That document, the guiding principles for continuous education, has been updated, and you'll see that link here. For the 21-22 school year. But as a part of that process, each LEA was required to draft and update for the current school year their continuous education plan. And that continuous education plan really was designed to ensure that LEAs had plans in terms of supporting a safe reopening of their schools, and again, that's from an LEA focused perspective. And hopefully LEAs were taking into account your feedback as it related to how your schools were reopening to serve their students. Also looked at student and staff well-being, and finally, and probably most importantly, accelerated learning for all students. And that's, whether that's in person, whether that's in a distance learning model or some kind of hybrid model. What LEAs also were required to do is to develop health and safety plans as it related to incorporating guidance from, locally here, the DC Department of Health, as well as the CDC. So these links will take you to both of those plans, and I'm going to just show you that website now so that you can see where you can find those plans. You can download them for each of the LEAs that whose students you're serving. Give me a minute to switch this over. Okay, so hopefully you should be able to see here the 2021-22 continuous education plans for each of the LEAs located here in DC. Let me make sure, I'm not sure I'm seeing this. Okay. Sorry, I'm experiencing some technical difficulties, so just give me a second here. Okay. All right. Hopefully you can see it now. Are you all seeing the OSSE website with the 21-22 continuous education plans? You can put a comment. Okay, great. So like I said, you'll see here, so each of our LEAs has had their continuous education plan and their health and safety plan reviewed by OSSE, and once approved, it's been housed on the OSSE website. So you can take a look and download any of the plans from your from the LEAs whose students you're serving. What I wanted to do is to just give you a sense of one of those plans. Here's a plan from Friendship Public Charter School, who has a number of students in non-public schools. To take a look at their plan, it covers, as I said, those three areas, with regard to, the safe reopening, supporting students and staff well-being, as well as accelerated learning. What you should be looking for in these plans is what the LEA has articulated with regard to supporting their non-public students. And, quite frankly, what I was really impressed with in looking at Friendship's plans is that in a number of places, Friendship has identified supports to be able to tap into. And I hope that it looks like that Friendship was able to talk with the non-public schools whose students, they're serving for this input. But what we can see here from this plan is that in a number of places, Friendship has articulated the supports to non-public schools in terms of collaborating with them, in terms of the reopening plans, for ongoing professional development, for ensuring that students' technology needs and equipment needs are met. I know in the beginning of the pandemic, there were several situations in which students at non-public schools didn't have access to, laptops or Chromebooks and Wi-Fi hotspots while they were in a virtual posture at home, within their community. And I know a number of non-public schools work with their LEAs to ensure that, all those students got those resources. So if you look at, these plans, you should be able to see the degree to which non-public schools and non-public students are the focus of those students' plans. If, as you're looking through and reviewing the continuous education plans from the schools, from the LEAs whose students you're serving, and you're not seeing it, we encourage you to reach out to those LEAs to, have conversations about what additional things that, they have in place and that they're engaging in that just may not have made it into the plans, but also what additional supports may be needed. So I encourage you to take a look at the plans, both for the specific LEAs whose students you're serving, but also, OSSE's articulation of, what those plans should entail. Okay. Any questions about the LEA continuous education plans before we move on? And friendship specific plan that we just briefly looked at is listed here. So if you wanted to go back to that one specifically, that link is here. Okay. So now what we're going to do is going to be another poll question, and then we're going to move into a group discussion. What I'd really like to do is to open it up to you all to hear from you and to share with your colleagues any experiences that you might have had working with community-based organizations or DC agencies with regard to supporting your students' mental health needs. Let's move into the poll question first. Kind of an obvious one, I know, but. We'll give it another 20 seconds or so. I got some feedback that said that sometimes the sound is fading in and out. I'm not sure if that's an issue on my end in terms of the connection here, or if it's an issue, an individual issue on somebody else's broadband connection. So if others of you could just give me some feedback to let me know whether you're experiencing that same sound fading in and out, it'll give me a sense of that. Unfortunately, I think, the room that I'm in here at OSSE, our HVAC system is a bit noisy, so I'm wondering if that's kind of competing with the, background noise here in the room. So I apologize for that. Okay, so I think we'll close this question. It looks like the vast majority of you, roughly 85, 87%, are saying that you have seen an increase in students' mental health, emotional, behavioral, or psychiatric needs, since the start of the school year. And that certainly that makes sense, which is obviously one of the reasons why we're having this webinar and really trying to identify additional supports that you might be able to tap into. So thanks for that feedback. Okay. All right. So again, what we'd encourage you to do, raise your hand and share out any of the current practices that you use to support students' mental health needs. Certainly, we know and are aware of the supports that you have within the school. We're happy to hear about those. But really, I think what would be useful would be the degree to which you've identified and tapped into mental health, behavioral supports for students outside of the school setting, potentially in students' home communities here in DC. So what I'm going to do, if you can raise your hand, I'm happy to unmute you so that we can hear from you. Okay, Miss Wilson. Let me see. Okay. Just give me a second. Let me make sure I can do this. What's going on here? Okay, Miss Wilson, see if you can unmute yourself.
I think I just did unmute myself.
Yeah,
can you hear me?
Hear you. Yes.
I'm sorry. I think are you because I raised my hand. I think I clicked that little button by accident. It's so tiny on my little computer. I am so sorry.
Okay, no worries. Thank you, Miss Wilson. Okay. All right. Let's see. Anybody else? Yeah, I think the only way that I'll know that you're you have something that you want to share is either if you put it in the questions, but probably the best way is to just use the hand signal to raise your hand. Oh, here we go. Mr. Johnson. Okay, Mr. Johnson, if you could unmute yourself.
Hello, can you hear me now?
Yes, sir.
Hello. Okay, great.
Yep, we can hear you.
Okay, so the question is, have you seen an increase in the emotional, behavioral, or psychiatric needs in your students since the start of the school year? I'd say yes.
How have you supported those students?
By creating individualized behavior plans. I'm a behavior specialist, so by creating individualized behavior plans and definitely collaborating with the rest of the team, including social workers, school administration, in some cases the LEA, and definitely parents.
What's been the result of that collaboration, especially with the LEA and with parents? Because I think that your schools, many of your schools likely have significant resources that you're able to put into supporting those students' needs within the school building. But in terms of kind of once students walk out of your building, what has been your experience with collaborating with the LEA and with the parents?
My experience, I mean, I've had mixed results, but for the most part, they have skewed towards positive. I think as long as there's a sense of communicate, long as communication is strong and there's a sense of cohesion, if you will, I think that that's why I think for the most part it's been positive.
Okay, great. Thanks, Mr. Johnson.
Thank you.
All right, anybody else? Okay. Don't know that I'm seeing anybody else with their hand raised, so I guess we can move on. So if anybody wants to put anything in the chat with regard to some practices in terms of supporting your students' mental health concerns, feel free to do that as well. But at this point, we're really ready to wrap up. Let's see. Oh, Tess, it looks like Ms. Westbury has something she wants to say. Let me see if I can unmute you. Okay, so Ms. Westbury, since you're participating by phone, if you hit pound 26571 pound, and that's pound 26571 pound, you should be unmuted at that point. Oh, Ms. Williams, let me unmute you. And then you can unmute Ms. Williams.
Great. And I just have a question, but also a statement, because it's not, I know the question is an increase in emotional and psychiatric needs, but we've actually seen, I work in a high school, in a non-public high school, we've seen an increase in students being detained this year, like a significant increase. And I know that is, also tied to mental health, especially after coming back in person after the pandemic. So I was hoping from this webinar to get some insight, some feedback to see if other schools or others, are in kind of the same boat, and see if there's any, resources or any supports that people find helpful for that. Because we have seen the, emotional, behavioral, and psychiatric needs, but also like it's just been like a significant increase of kids getting detained. So I just wasn't sure if we could spun that a little bit.
No, I think all those issues are interconnected. With parents and families being kind of tapped into. I just read a headline of a mother who was kind of under investigation or being investigated because she left her 14-year-old to care for multiple other children in the home. And it's like, okay, there are support issues, there are supervision issues, especially when parents are having to wrestle with things like being out for COVID, or having to cover extra shifts because other people are out for COVID. Who's watching kids? So there are certainly supervision issues that come up, but also other mental health needs, other psychiatric needs that aren't going addressed certainly can manifest themselves in the kind of acting out behavior that winds kids up in detention. So certainly we recognize that those issues are interconnected. I'd be interested to hear from other folks in terms of how you are tapping into and addressing those. I think some of the resources that we talked about here, the DHS PASS program, the multiple PASS programs, PASS ICM, those programs I think are designed to get at what we would call kind of PINS needs, persons in need of services, on the front end in terms of being proactive. I don't know if that answered your question, Ms. Williams, but
yeah, it did. I mean, it's nice to know that, because I kind of want to hear from others too, like if others are experiencing that in their programs as well. But I definitely agree that it has to do with, it's all interrelated. I mean, we have a lot of the kids right now that are struggling with being a parent versus trying to come to school, or, it's manifesting themselves in a lot of poor behaviors outside of school, or pouring over into school. So I just wanted to see if other people had similar experiences.
Yeah, somebody commented about, I think along the same line, wondering if non-public schools are experiencing an increase in aggressive behavior from students. I think we're seeing some of that with regard to our incident reports that we're reviewing. As you all are submitting those, we're certainly seeing some of those issues as well. How about others? What are your thoughts in terms of the juvenile justice, detention, kind of increases in students being detained. All right, let's see. Ms. King, I'm going to unmute you. If you could unmute yourself. I think you had something you wanted to add.
Actually, I think I must have misunderstood the question. I thought you had asked who we reached out to. I'm at a non-public in Maryland, and this has been a great resource, by the way. But some of the people I've reached out have been the Quality Trust Family Ties and Total Family Care Coordination, just to figure out where I can send my kids for help. Because I've had a hard time getting information sometimes, being a non-public in Maryland.
Sure, and I think as kids, you know, students kind of leave the district, you know, it's not like they leave all those issues behind, you know, which is what, again, why we really wanted to have this webinar, to be able to identify what resources may be available to serve as supports for the challenges that we know our students are having and that you all are seeing in your settings. Thank you. All right, I'm not sure I'm seeing any other hands raised. So I think we're going to wrap up here. My contact information is listed here at the end. We will be sending this slide presentation out. You can download it certainly in the handout section of the interface here. We'll be sending it out along with a brief, you know, survey of this webinar to give us some feedback on, you know, additional topics you want to see in the future, how we could have, you know, what we did well in this webinar, what we could have improved. So please be on the lookout for that. You know, and again, if you have questions for me, feel free to, you know, reach out to me, and, you know, I can answer them, whatever I can answer myself. I'm happy to do that. And, you know, we'll find additional resources for you for those things I'm not able to answer. So let's see, we are at 11:10. We've got about 20 minutes that I'm giving you back of your time today. We thank you for participating, and we look forward to hearing from you again. So at this point, this webinar is concluded. Thanks very much.